Ready? Okay. So what we're going to talk about here is the diaphragm. So this muscle sits underneath the ribs. It's like a dome-shaped muscle. Attaches all along the front, the sides, and the back of the ribs, and even the spine. And it is technically the top of your core musculature. So the bottom would be pelvic floor. Top is the diaphragm. You got your abdominal muscles in the front and your lumbar muscles in the back. So it all encases the abdominal cavity. So diaphragm is really important because it's influenced by stress, anxiety, those things that we all deal with on a regular basis. And it's an area that people don't realize gets so tight. We are very aware of our shoulders and necks getting real tight and our low backs and things, but we don't think about our diaphragm as something that gets tighter. We're just not aware of it usually. So to relax the diaphragm, you want to use your exhalation. So the diaphragm is an inspiratory muscle. So when you breathe in, it's going to be contracting. And the thing is, a lot of people breathe in and oftentimes hold their breath, but they don't do such a good job of breathing out. So we all know, like, when you breathe out like that, when you sigh, it does help to relax things a little bit. We just don't do it very often. So you want to bring your attention to that. Try to work on relaxing. So first thing I'm going to do is I'm going to try to release this. Now I'm not going to do this in standing like this generally. I'm just doing this to demonstrate. I would be lying down on my back or on my opposite side to be able to relax my abdominal muscles here. But I'm going to take my fingers, I'm going to kind of curl them up, almost like you're impaling yourself. You're going to be up under the ribs here, and you're trying to, especially on the exhale, trying to sink those muscles in. But again, I'm standing, so I'm not going to get real deep with that. You want to make sure those muscles are truly able to relax. And every exhale, you're going to go a little deeper up underneath the ribs. You can work your way back. Just be aware there's these floating ribs back here, so don't crunch those things. Try to get more up underneath the rib cage and work your way back that way. So we can do a couple of like moves to stretch that too. So I'm going to put my hand behind my head. Make sure you don't have any shoulder impingement pain with this. Even if you have shoulder impingement, if you do it properly, you shouldn't get much, because what's going to happen is you're going to be able to use your body and your scapular muscles and your thoracic spine and ribs to be able to adjust this. So if I'm targeting my right side, even though I just released my left diaphragm, but if I did my right and try to target that, I'm going to put this back here. I'm going to do the shift and lift. And I'm going to try to open up this whole side of my body here. And as I exhale, it's very important, you exhale and open that up. You can play around with that when you're sitting, like in a chair. You can have your chair next to the wall too. I do that sometimes if I notice I'm getting tight. I can just practice that just for my seated posture and breathing patterns to make sure I'm not getting too tense and tight on one side. And that's pretty much it for the diaphragm.